So hello, everyone. My name is, in the name of the National Behavioral Association, the National Hispanic and Latino Addiction and Prevention Technology Transfer Centers, we welcome you. My name is Ana Chavez Mancias, and I am the Program Specialist for the National Hispanic and Latino ATTC. Welcome to the second session of a three-part series titled Understanding, Going Through, and Managing Loss, Grief, and Bereavement, Life with the COVID-19 Pandemic for Latinos with a View on Latino Men. I will be your host for today's presentation. Next slide, please. Before we introduce our amazing presenter, here are some brief instructions about our event. Here is the information about our grant. You will receive a copy of this presentation so you can read the content at your own convenience. Next slide. This session will be recorded and archived for future playback. A copy of today's presentation will also be made available. The lines will be muted through the presentation to minimize background noise. When we get to the Q&A portion of our webinar, you will have an opportunity to ask questions by clicking the Q&A box, and we will share your questions to our presenter. We will also be asking you to fill out a brief survey at the end of the webinar. This satisfaction evaluation is important to the work we do and provides us with the opportunity to improve our training efforts. A certificate of completion will be sent via email at the end of the webinar. Closed captioning is available for this event. You need to activate your screen by clicking the live transcript button at the bottom of your screen, then choose to show subtitles. Next slide, please. We'd like to take a moment and reflect on the power of words and remind you that together we can use our words to create positive change. Next slide. Here is the TTC network map with information about the addiction prevention and mental health technology transfer centers. Each network is comprised of 10 regional centers and 3 national centers. The network's coordinating offices, National American Indian and Alaskan Native TTCs, and the National Hispanic and Latino TTCs. Our centers has a national focus for Hispanic and Latino communities and the workforce that provides services to these communities. Next slide. Please allow us to introduce our parent organization, the National Latino Behavioral Health Association, NALBA. NALBA is a nonprofit and is located in New Mexico, with the mission to influence national behavioral health policy, eliminate disparities in funding and access to services, and improve the quality of services and treatment outcomes for Latino populations. Next slide. NALBA's objective is to provide national leadership on mental health and substance abuse concerns of Latino community. NALBA's policy priorities are selected capacity expansion of mental health services for Latinos, Latino behavioral health evidence-based practices, legislation to increase the number of behavioral health professionals, funding for co-occurring disorders of alcohol and substance abuse, opioid crisis in Latino community, and suicide prevention. Next slide. We want to take this opportunity to invite you for the 2022 National Latino Behavioral Health Conference, Latino Behavioral Health Equity, Juntos Podemos, in September 15 and 16, 2022 at the Sahara Hotel in Las Vegas, Nevada. The conference will provide a forum for behavioral health professionals from different areas to connect, exchange ideas, and together explore best practices to attend the Hispanic and Latino communities. I will ask my colleagues to share the conference website link on the chat so that you can take a look and learn more about this incredible event we are organizing for our communities. Next slide. Our team is staffed by Dr. Susie Villalobos, serving as project director for both centers on the National Hispanic and Latino PTTC, we have Priscilla Jamasi as project coordinator and Cristina Mancebo Torres as the program specialist. And I am working as the program specialist for the National Hispanic and Latino ATTC. Next slide. Now it's time to introduce our presenter. Elizabeth Robles works in El Paso region as a behavioral healthcare professional specializing in life changes, trauma, grief, and loss. She's certified in thanatology through the Association of Death Education Counseling. Elizabeth brings to her practice a profound understanding of death coupled with grounding in neuroscience. Her treatment approach offers patients the hope and strategies to facilitate continuous emotional renewal in the face of life's constant changes. She is also the founder of the Facebook group Aquí con Death, as a bicultural space where people can learn and share their unique perspective about death and grieving. In addition to her private practice, Elizabeth serves as clinical director for the MYC Institute of Integrated Health, an El Paso nonprofit organization which advocates for body, mind, spirit approaches to well-being. In 2020, Elizabeth became a certified end-of-life doula. Next slide. Elizabeth, thank you for your availability to share your knowledge and your expertise with us. Please feel free to start your presentation. I already had the opportunity to attend some of your training sessions, and you are just amazing. Thank you again. Please feel free to start your presentation.
Thank you, Ana. Good morning, everyone. So this is the second part of our three-part series. I'm very grateful to be here. I'm very happy. And again, I want to thank NALBA. I want to thank the ATT and PTT centers for this great opportunity. And so today we're going to do a quick review of what we talked about last week, and then go on to the center of our presentation for today, which is a little bit of the focus of how COVID-19 bereavement, grief, and loss has affected us. Next slide, please. So here we're going to talk very briefly about the fact that grief is a natural reaction to loss. Grief is both, as I mentioned, very much universal because it affects us all, but it's also very personal and a very intimate experience. It's about the fact that each of us is going to deal with and experience this phenomena of the end of something, whether it's a loved one, like in this case that we're focusing on, or any other loss that we have, the loss of a pet, the loss of a change in maybe where we live, the fact that we're graduating from one thing to another, a lifestyle, an illness can bring a lot of loss. So there's multiple losses, many, many losses, but at the end of the day, it is something that we all experience, and it is also very personal. The more we understand that death is a natural part of living, the more we become comfortable with this concept. And I will always say this, and I think that is what I think some of us who work in the area of grief, loss, bereavement, etc., we really have to come to terms with understanding that this is a natural process for all of us. It's not right, it's not wrong, it's part of who we are. And living is one aspect, but that transition, that last transition that has to do with dying, is also a very natural part of us. Recovery from loss, grief, and bereavement is absolutely possible. There's no reason why we can't say, I will not get through this. How will I get through it? What can I do to make that easier for me, to ease this journey and to learn from it and to make meaning of it is really what we want to focus on in so many ways, because we are made as human beings with a level of resiliency to adapt to loss. Every one of us benefits from the notion and the possibility of healing and recovering from that intensity of the pain. Next slide, please. Symptoms related to loss may manifest in a physical, emotional, cognitive, and spiritual way. And I'm not going to get into all of them because we reviewed them last week, but just be aware that any one of us who is going through the journey of grief and bereavement is going to feel it, is going to have an impact in our physical body, is going to think about it, is going to maybe have certain views change because of this experience. And maybe we can go back to feeling better. There's no reason why we can't, unless there's very specific certain circumstances that are affecting us. Excuse me, but at the end of the day, we know that we are so dimensional in how we experience things that we may have symptoms that come about in these four areas. There's also many types of losses and also types of griefs. And depending on each circumstance, we're going to see that because, you know, a simple waking up in the morning and seeing that you have two new little gray hairs, that's a loss of that hair. It's no longer going to be pigmented. Or the fact that you get up and you don't do things the way you used to because now you have to adapt to a change that has happened in life, that's a change. So loss is not always I'm losing. Change comes and transformation happens. And that too has the implicit understanding that there is a loss. So there's many, many griefs, as I've mentioned. For us in Latinos in the United States, we have seen the data. It has been reported in the news. There's all kinds of institutions of higher academic learning and science and everything else, understanding that as Latinos, this population group has been severely affected by pandemic, by the COVID-19 in many different ways, in pretty much any aspect of our life. And our public health officials report that the numbers of casualties and infected individuals in this particular population and us as Latinos has been disproportionate to any other group in our country. Next slide. So what are some of the changes in quality of life and standards of living conditions for Latinos? So these are some of the factors and points that I recognize that I researched from the Pew Research Foundation, and they're very up to the day kind of information. Many Latinos in the United States express that they have lost their job or they have had to take a pay cut given the circumstance of COVID. They have had problems maintaining and paying the regular bills, you know, the utility bills, the things that are an expense on a monthly basis. They have had problems attaining food from the local food banks because we know that supply had been an issue, and maybe it's getting a little better now, but it has been an issue and we can still see it. You go to a restaurant and you see that the menu has less items, or you go to the store and there's some shelves that are still empty. And so food banks are not any different. And I think there's a lot of power in understanding the impact that this pandemic has had when there's lines and lines of people trying to get food because they don't know where that food will come from today or tomorrow, and that there isn't enough of a supply. It's a very serious concern for us as a community and as a society. If people report they have had problems paying rent or their mortgage. They have had to receive government food assistance, and that may be something that is for the first time. And it's also something that has a lot of implicit biases, because there's this notion sometimes that we access these kinds of services because we don't want to work, because we want to have it easy. And pandemic has made everything very difficult, especially when you have issues of pay cuts or joblessness. And we know that there is a societal problem right now in our country about a workforce that can come in and take care of the needs of foods, of services and goods for us. But I don't think we have done enough research, and we have given people the understanding that there is a disabling component to people's minds, given specifically the pandemic. This is not a new concept. This is a concept that we had never dealt with because we have not had a pandemic in the past 100 years. So this is new to all of us. So a lot of people say there's a resistance to go back to work. People are lazy and they don't want to go back to work. And with all due respect, that is not the case. We need to inform ourselves and educate ourselves that there's very specific psychological impact and physiological impact to the brain when we're going and undergoing these different stressors that I'm naming right here. So we know that a lot of people have had trouble paying for medical care. And we know that a lot of people have had tremendous difficulty accessing medical care. A lot of people have received unemployment benefits for the first time. And many, many, many Latinos have lost health insurance, which is another very big problem, because if there is an exposure to COVID, how do you access help? And a lot of people do not understand that if the person is diagnosed with COVID-19, then they need to access help. They need to get medical attention so that the symptoms and everything that comes about with moving through this virus are not so impactful on that person's body, and hopefully does not take them to a hospitalization or, of course, death. And so all that lack of literacy and those barriers have an impact, a tremendous impact on this disproportionate amount of people, as in the Latino population, that have been afflicted by the infection of the COVID. Next slide, please. Changes in the quality of life and standard of living conditions for Latinos. Our standard and quality of life is our core element for a person or a family's growth, well-being, and progress in general. So we have to look at these two terms and how important they are for every one of us, because it is totally related to everything that I just mentioned about the circumstances that we're seeing, and it's totally related to the bereavement, the loss, the grief that people are going through. And how do you apply these concepts, these events that are happening to each of us into that standard and that quality of life? The pandemic has impacted the very core of this pillar for Latinos. Due to the multiple and various circumstances with the economy, the difficulty in the acquisition of goods and services, the disruptions in educational settings for the children, for students, not having to be at home, having to come back to the school setting, having difficulties with that, being exposed, and that, there's a higher potentiality for the fact that they could contract the virus. All these accentuated challenges in the ability to receive healthcare services, as I mentioned, and the overall view for Latinos as we are going through this pandemic is very challenging. And it's even more complex now than it was before, because unfortunately, these specific matters for us are not new. This didn't come about because of the pandemic. They were existing already. They just have been accentuated and deepened and have become more impactful because of the pandemic. Next slide, please. The difficulty of not saying goodbye. One of the things that I think has been most prevalent, and many people talk about it, is the fact that because of the hospitalizations and because the need to continue to maintain protocols that will not increase the contamination of ourselves because of the virus, there has been endless circumstances in which people have not been able to be with their loved ones in a hospital stay. And that is one of the most prevalent and difficult challenges that I have experienced as a psychotherapist in my practice, about the fact that people feel very bad, that millions and millions of them were not able to be with their loved ones in a hospital setting, either going through the illness or unfortunately being there in those last days and last moments because of the fact that these people died. The reality and events of an interrupted loss process can prompt many symptoms related to mental health disorders, such as acute stress, anxiety, depression, substance abuse, trauma, prolonged grief, and complicated grief, just to mention a few. Because again, how are we coping? How are we dealing with the fact that it's very normal and very natural for us to be there at the end of someone's physical life? And when we're not able to do this, it's not just a matter of closure, because closure doesn't come like this is completed and I'm done and I go on with my life. This process, this saying goodbye, this being present in the bed of a dying person is very significant for everyone. And in our culture, it is viewed almost as an honor, and it should be an honor, because we are honored when someone is being born and that baby comes into this world. They have not only a team, but they have family members, father, grandmother, etc., because it is such a big deal. Dying is a big deal. And COVID-19 has robbed us of the opportunity to be there in that last transition and to say our goodbyes and to hold that hand and to say, I love you, and to come to an understanding for the persons who are left behind, for us to say, I really do understand this person is no longer living. Their body has ended. And I have to come to terms with that. I need to adapt. I need to find ways to move through my life now. But I saw that. I understand that my brain has a sense of this finished. And maybe, most likely our grief and our bereavement begin. But when we don't have that, did that person leave out of town and hasn't come back? What is the sense of where do I go from here? And that has been a very, very significant problem for anyone. But as Latinos, we know that our cultura, our culture takes us to these points in life in which these transitions are very important. They have as much meaning as everything else that we do with our families, our friends, and our community. The sense of prevalent fear, uncertainty, and ambiguity have been the driving force of this whole event for us. Across populations, and Latinos have been deeply affected by not having the opportunity to say goodbye to their loved ones and by dealing with all these added circumstances that I had just mentioned before. Next slide, please. The difficulty of not saying goodbye, not paying our respects, and the pain of it. And like I say, this is a very cultural, important norm to who we are as the identity of our population, because it is about respeto. In our cultura, respect plays such a major role. We talk about it, about our young people having respect for their parents, for their elders, for the grandparents. We talk about respect when we interact with a professional, with our lawyer, with our doctor, with our priest, with the pastor, with someone who represents that respect. And we have mutual respect as each other. And that respect takes us to, for example, the word that I've never had a translation for in English, you, usted. Because I show my respect by addressing you in this way. And that means that I acknowledge you and I have a level of understanding that I respect your personhood. When we're at the end of the road and someone is lying on their deathbed, to pay our respects is very important. It is something that is left behind and we remember. I remember who was there when my mother died. I remember who was there at her funeral. I remember this, I remember that. Though that's the way we show our respect. So we not only get to not say goodbye at a hospital setting, we don't know what time that person died. I mean, we get told they died at 12:51, but we were not there. Then the funeral happens or some kind of ceremony that has to do with cremation, burying, etc. A lot of people, of course, have the religion that they use at those moments for that farewell, for that respect, and we are not able to gather. Things have changed somewhat now at this point, and we know that there's a lot of more accessibility to each other, but it's at the cost of the risk because the COVID-19 pandemic and all its variants has not ended. We are still, as a planet, as a world, as a humanity, we are still in this pandemic. We're seeing the fifth or the sixth wave of it, but studies always tell us that a pandemic lasts between 4 to 7 years, and we are not there yet. So there's a risk involved in going to pay our respects. And for some people, it's not a viable possibility because they may not be able to because of healthcare reasons, because of fear, because that would be the best thing to do, to not go, not because we don't want to go, but because we have to safeguard ourselves. And so this continues to happen on a daily basis. No paying our respects, no pude ir. I was not able to go. I was not able to be there. And that haunts us, that guilts us. Sometimes it brings about so many other emotions for anyone because death is so important and it's so meaningful. And we need to console each other because most of the time we're heartbroken because we love. And so we want to console those have stayed back, and we want to respect that person and honor that person who has left. Pandemic has taken that away from us. Next slide, please. Latinos have been heavily affected by loss, grief, and bereavement, as I said, because of COVID. The cultural implications that the phenomena of the pandemic has created for Latinos is palpable in the disruptions of our cultural views, our norms, our value systems, our traditions, celebrations, rituals, ceremony, spirituality, and religiosity. And I think you can agree with me that all these points that I have just made are pillars of the culture that we live with, that we embrace, and that is a standard to our lives as a population, as a group. Latinos, we put so much value into these specific items that make up our life and give meaning to it, because it's a very family-oriented culture, because it's a culture that depends one on the other to show this and to socialize and to gather. And COVID-19 has said, you will not gather. You cannot. You cannot take the risk. And if you take the risk, things may happen, especially when we saw the beginning of all this and when we did not even have the vaccinations. The act of gathering to support each other in celebration, in the practice of faith, in distress as a way of offering support, especially for us in the time of illness, incapacity, or death have been basically non-existent as a way to express ourselves. And you know, you hear someone who has passed away and you say, I have to go to the viewing, or I have to go to the services in the morning. I have to show my face and I have to show my respect. I have to support the family because I'm going to run into them, or I'm going to invite them to come over to the house for enchiladas one of these days. And then what am I going to do? We say, get cara pongo. What face do I put? Because I wasn't there for you then. And in our culture, the cultural view is, I'll support you, you support me, we support each other. So this has hit at the heart, at the strings of who we are as a cultura. And it has been very difficult to assimilate that because there's a lot of aftermath of emotions that come with it. Next slide, please. The disconnect between our norms, values, and coping systems in the face of COVID. The expression and practice of our values in our cultura and the absence of these practices during the pandemic, as I've said, have created deep grooves in the psyche and the spirit of Latinos as part of our multiple losses. So when we look at secondary losses, we're looking at the phenomena of, I have a secondary loss if I lost a loved one, but I have a secondary loss, and I have multiple really secondary losses because of pandemic. Because a large part of my identity in this, as I just mentioned, has been removed. I went to the funeral via Zoom, and studies show, because I have read the studies, that there's actually more complications in terms of behavioral health from people if they attended the Zoom funeral, that they were seeing everything through a lens versus not going. Can you imagine that? How difficult it is for our mind to know that we're watching this very painful event, and we're watching it through the lens of the magic of what I'm doing right now with a Zoom camera. But at the same time, it leaves a level of sequel that is more impactful than if I had not even seen anything. And we would have to think that it's the reverse, that at least you got to see it through a camera. But the studies tell us that that is not the case. So we know that as a group, as a people, the general, obviously there's a lot of specifics and we know that, but the general consensus is that the way that we have had the opportunity to come to terms or be there for someone, the way that we have had the opportunity to be grieved and bereaved and to continue with that has become very complicated. And then we have all the other impacts that come about from being a member of our society that I mentioned earlier. So there's a level of very consistent stress, and we need to be aware of that, and we need to try to manage that so that we don't have negative long-term effects. Next slide, please. So grief in our brain. I always look at how is it that the brain is acknowledging things, because I think it's very important. At the end of the day, that's really what it's about. Our brain directs every part of what we do, who we are, how we move, how we live. And so to me, grief and the brain are something that needs to be acknowledged and understood. We can do a whole 3 hours just on that, but very briefly, I'm going to talk about a few things. So there's a quote here that I like from an expert who is Dr. Schulman through the American Brain Foundation, and she is a neuroscientist who has really focused on the function of brain grief and also on the function of brain and trauma. And she says that grief is a normal protective process. This process is an evolutionary adaptation to promote survival in the face of emotional trauma. So grief is a normal protective process. The actual verb, the actual action, if you will, of us feeling the grief protects us. We need to feel that in order for the mind not to scramble and say, I'm going to have a nervous breakdown, because it's such an impact. So the process of being able to grieve serves as a protective mechanism to our brain to be able to process this change. And that's totally different than what we've always been learning, because we learn, oh, grief, I don't want to hear, I don't want to know, don't talk to me, I don't want to be part of that, that hurts, I understand. But in reality, it's our friend. It really is our friend when it comes to our brain. And this process is an evolutionary adaptation. That's perfectly said, because we do evolve as beings. We do evolve as sentient beings, and we need to adapt to change, because change is constant. Whether it's a loss or not, it is constant. And so this promotes that survival in the face of this traumatic event. So grief is our friend, and we have to remember that. The brain interprets grief as an emotional trauma or PTSD. So what I mean by that is that the way the brain functions upon the face of death of a loved one is that it's going to use those parts of our brain that are associated with trauma or with past trauma, and we have that memory, which is PTSD in short. The human brain handles emotional stress and stress using the same process as it does for grief. So grief and stress, the brain is going to process it the same way. So when you're stressed out, you can understand when you're grieved that it feels very much the same. Changes in the brain function go largely undetected. That means that it's not going to make major impact when the individual continues functioning normally, but these experiences still affect the way the brain works. And I think the reason why this particular point is so important is because there are circumstances, there are events, there are experiences that our brain can go through that will literally change the structure of the brain. Here, what we are learning is that the brain's functions are there and they continue, but they're not necessarily noted as something that has impacted the brain to the point of changing it. Yet, and hopefully this continues in a normal way, yet these experiences are still going to change how it is functioning, how the brain is going to adapt or deal with it. And we just learned that grief feels like trauma. Even the effects of long-term chronic stress are reversible. And I'm not going to go into a lot of neuro stuff today, but we know that there is incredible, wonderful information now for the past 30 years or more that says that our brain has the capacity to heal. A lot of times, what we need to do is focus on that healing. And self-care is critical to that. But self-care comes through the way of awareness, of understanding, of mindfulness. A lot of times we think self-care is I'm gonna go get a haircut and a pedicure and a manicure, and that's beautiful, that's wonderful. But it's more of you doing things that are going to take you to a space where the brain, particularly the limbic system, do not feel like they're under attack, they're assaulted, they gotta be aware, I gotta be aware, I gotta be aware. We gotta shift more into mindfulness, relaxation practices, journaling, cognitive behavioral therapy, for example, counseling, creativity is very important, meditation, yoga, any of these activities that take us to kind of settle our brain, settle ourselves, and give the brain the opportunity to be aware of that present moment. That's going to be very important as we try to recover our brain, to recover our brain from this very important impact. These strategies allow feelings of safety, of security, and calmness to return to us so that we can move forward. And in last week's presentation, I mentioned fear. Fear as one of the primary emotions that come to us in the face of death. Fear before the death, because we are fearing that person leaving and they're no longer going to be with us, and what am I going to do? And then once that person dies, understanding that that loss changes my world. And how am I going to be in that world? You know, I read one day that we cry when someone dies, and we cry for them to a certain extent, but we cry for ourselves. We cry and we try to console ourselves for this huge, this incredible loss that we have just undertaken, because life has taken us to that. So we can see here how the brain is trying to make sense of all this and working with it as best as it can to find that resilience, to find those sources of I have to continue, I can continue, I want to continue. Traumatic experiences need to be worked through, otherwise they will continue to be an obstacle in our life. And that's very specific to trauma. Grief may have traumatic tinges and may seem like trauma to the brain, but grief or loss rather, and grief may not necessarily be traumatic. It's a huge change, but it may not always be traumatic. Grief is something that we can naturally evolve and move through if we decide to do the bereavement. Trauma is something that needs to be worked with. Otherwise, it will never go away. We have to acknowledge it, and we don't want it to be that obstacle in the process of our journey of life. Next slide, please. So here I'm going to just briefly break down a little bit of how the regions of the brains are affected by grief and what are the regions that primarily are affecting this, or the three regions that are affected by grief. So the prefrontal cortex right there, number one, which you can see in the blue area, that is the cerebral covering. It's the front part of the brain, of that frontal lobe. And this, all the studies tell us that it is involved in the planning of complex cognitive behavior. So it's our personality expression. It helps us with decision making. It moderates our social behavior. And basically, it's the part of the brain that is considered to orchestrate, to kind of conduct, if you will, the thoughts and the actions in accordance to our internal goals. So the most typical thing that we know from here, the one thing that we always talk when we talk about the prefrontal cortex is that it is our executive functions that are there. And so executive functions that relates to the ability to differentiate, for example, between bad and good, or between better and best, or same and different. And it also helps us to deal with or understand future consequences of an activity. So let me give you an example when it comes to bereavement, or when it comes with grief and our prefrontal cortex. I'm not bashing the funeral industry in any way, shape, or form, but when we are at that grief moment and we have to, for example, make funeral arrangements, the prefrontal cortex is front and center. And right here, we are seeing that during grief, it becomes a little bit more underactive. It's not in full force because it has taken that hit of understanding the loss. So you go to a funeral home and the person says, we need to honor your loved one, your mother, your father, your grandmother, your uncle, whoever it is. So let's do this, and let's do this, and let's do this. Well, if our prefrontal cortex is being affected right now because we are so grieved, then our decision making is going to be affected. So I'm walking in with a budget of $5,000, and all of a sudden my budget is $11,000 because my prefrontal cortex is inhibiting me from making the decisions I usually make with that same clarity and objectivity. And again, I'm not bashing the funeral home industry. I'm just saying those are very clear examples. Or when there's circumstances and interpersonal relationships with a family, and he said, she said, they said, and why did you do this? Why didn't you call my grandmother? Or why did you not put that dress on my aunt? And, blah, blah, blah. All these little things that all of a sudden become very big have a direct relation to the function of our prefrontal cortex. Amazing, right? So the prediction of outcomes, the expectations based on actions and social control is what we say. In other words, the ability to suppress urges that perhaps could lead to socially unacceptable outcomes during these times is very common. So I know that I remember circumstances when I was a little girl that maybe one of my aunts passed away, and the mother, and I mean children, the kids, like one of the children was highly intoxicated with alcohol. So they were acting out during the funeral services and crying and yelling and talking loud and having inappropriate behavior because that prefrontal cortex is affected and it's underactive. Now we look at the anterior cingulate cortex, the emotional regulation center of the brain, that too becomes underactive when we are stressed by the face of death. So here the activity of what we call the ACC, the anterior cingulate cortex, is related to also decision-making, to socially driven interactions, and empathy-related responses. And I know there's a woman that I worked with many, many years ago, and every time she talked about her mother passing away, that she had found her dead at the house, and the lady had a long history of cancer. Unfortunately, she died by herself. Something happened and she found her dead. She would start laughing. She would just start laughing, laughing, laughing nervously. And some people told me, how rude. How can she be laughing about her mother's death? I really don't think she was laughing about her mother's death. I think her anterior circular cortex was so under active at that moment that instead of her taking a more somber, more serious response to what she was telling us, instead of that, it was giving her laughter. So this empathy related response may not always be at its best because that part of the brain is being is not acting or not being as involved as it should because of all the chemistry that's in there and the impact. So the ACC lies in a unique position, as you can see it right there. It's the light orange, light salmon color, and it's between all that area that's yellow and even more, which is the limbic system. And it's right between the limbic system and the prefrontal cortex. So we know that there's going to be changes in the decision-making process, in the including of the motivation and cost-benefit calculations. Fascinating. I just talked about the funeral expenses. So here you're looking at what is my cost and benefit, and how can I say, is this in the long run the best thing for me or not? And I may not be able to because I'm compromised. The ACC also has an important role in the integration of the neural circuitry. In other words, it does a lot of connection to the affect and the regulation of that affect. How am I? Am I in a terrible place? Am I able to cry? Am I able to verbalize? Can I rest? Can I sleep? How do I feel? Am I going to lash out at someone because they never came to see my mother before she died? Or am I going to take things calmly? All this is the magic of our brain. And, the anterior circular cortex plays a major role. So it's very important to understand also that this part of the brain is one that perhaps has us avoid painful emotions such as, certain behaviors, substance abuse, binge eating, suicide, etc. So for those of you who are in the healthcare, mental health care field, as myself as a licensed professional counselor, and you work with your clients, know that a lot of what you're trying to do is find ways to cope and help with these coping mechanisms so that they can identify them and understand that this is a very integral part of what they're going through. And so we want to minimize the negative impact and increase a way to manage. Now we have our friend, the amygdala, and that is part of the limbic system. You see that horseshoe part, I'm not going to talk about that, but that's the hippocampus. And then the amygdala, there's one on each side of our regions or hemispheres of the brain. And that is the fear center of the brain. And that, instead of becoming underactive, like the prefrontal cortex and the anterior circular cortex, that actually becomes overactive because it's fear, 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 attention, 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 survival, survival, survival. What's going on? What's going on? What's going on? Someone's dying? Was I in an accident? Was this, what happened? And am I safe? And are those around me that I love, that are important to me, are they safe? So the amygdala starts working overtime and really working hard. There's a reason for that. Remember, we have the fight, flight, and freeze, and that it comes directly from that. So when the amygdala is affected, you're going to see changes in that behavior. The amygdala is that tiny little, as you see in the yellow, it looks like a little almond-shaped form, and there's two parts to that. There's one in one hemisphere, as I said, and the other. So whenever our senses detect our change in our surroundings that could be dangerous, the amygdala is responsible for preparing us for that. Do I fly? Do I fight? Or sometimes do I freeze? Because it could serve as a way to protect us. And it is responsible for the perception of emotions such as anger, fear, sadness, as well as control of aggression, directly related to bereavement, to grief, to loss. So these parts are very, very important in the brain, and know that sometimes we may do things that we say, where did this come from? But our brain is literally being affected by grief. Next slide. More concerns about the unattended grief for Latinos. Another matter that is very important for us is the concept of ambiguous loss. This is a type of loss that leaves the grief person with a sense of lack in the resolution of their questions, of their concerns, of the aftermath. Feeling an emotional lack or emptiness towards the closure of the actual process, especially in the initial grief experience. And in ambiguous loss, there's an uncertainty about the future and the coming to terms with the loss that may be very difficult for us to fathom. It almost feels surreal. Ambiguous loss, sometimes people say it's like disenfranchised loss, and it's not. It's two different things. Ambiguous loss is one thing, disenfranchisement or disenfranchised grief is something else, because the ambiguity on the face of loss here is very specific to, I don't really feel I am comprehending, I'm understanding, I am absorbing, I am coming to terms with this death, with this loss. And it could be any type, but today, the series is we're focusing on people. And so it's very different than disenfranchisement. And sometimes people confuse that. So I want to be very clear, because disenfranchised grief is people do not understand that I need to have this grief validated, honored, because they don't feel that it's a grief that is very sociably common. So it's two different things. Ambiguous loss is concerning to us because COVID-19 brought so much of that. That person left, they were gone for a month and a half to the hospital. They transferred them, they said things are getting better, we're gonna do rehab. And then they got to rehab, and a day later they said, your brother, your uncle, your husband, your dad, your whoever just died. What happened? Well, we don't know. We just know that he went into a heart attack, and we tried to save him and we did everything possible, but unfortunately we lost him. All kinds of ambiguous loss. I didn't see the transfer. I didn't see my patient. I don't know what happened. I was not outside the door waiting as they were calling the code blue and they were trying to, revive my loved one. So there's this sense of what happened and how do I continue? Because I don't have, I'm not settled into even just the feelings of loss. So it's very specific and it's very concerning, because when you live with this ambiguity about the loss, when do you come to terms with it? How does the brain, after what we just saw, come to a realization that I have to function and that I have to understand that I need to bereave this loss? So it can get concerning and complicated for people. Next slide, please. So what I did is I just did a little diagram here to highlight a bit of some of what we've just talked about. So we start off with the illness, the contamination, the infection of the COVID-19 virus. There's death, there's loss. We try to start this grief and bereavement process, and then we know that all of a sudden maybe there's more losses. We hear of friends, we hear of loved ones. It's just consistent. It's constant and consistent. Then we have the virtual mourning, for example, as a possibility. When we have that, as I said, that doesn't mean it's a bad thing, but it doesn't really give us the closure, the understanding, the permanency of death. And we're trying to grieve and maybe recover a little more. And as we do that, perhaps there could be more losses. And so we're looking at traumatic grief, as I mentioned in the first session, compounded grief, because you're looking at a lot of loss, disenfranchised grief, ambiguous grief, prolonged grief, and or complicated grief. So as you see, we go through a big gamut of information with these events in our life. Next slide, please. Other factors that may complicate the grief on our bereavement journey can be a continued isolation, challenges to the acquisition of goods and services, financial restraints, as I mentioned, all the secondary losses that come, and I'll talk about that in a minute a little more, other mental health comorbidities or other things that may be happening with that person even before all this occurred, physical illnesses, continued stress because of the pandemic, feelings of guilt or hardship or losses with the family or friends, losing the status in the family hierarchy. I'm not able to because maybe I could not attend to that caregiving duties that I had. I couldn't go to the funeral because maybe it's another country of my country of origin because of the pandemic, because of circumstances. Next slide, please. So very quickly, important symptoms to consider during grief and loss. As I mentioned in the first series, fear is a primary and almost instant emotion that we're going to feel: fear of the loss of that person, fear of what continues for us. Denial is not really wanting to, or not being able to come to terms with acknowledging that this loss has happened. And when we're looking at the scenarios that we have during the pandemic, it's just made it even more accentuated, because I don't want to deal with it, and I don't have the experiences that I live to deal with it. So it makes it very difficult. Shame and guilt are not the same, but they work very in tandem. And shame can be, I'm ashamed I wasn't there. I'm ashamed this happened. You see shame very commonly in children because they're having to struggle with making sense of loss and death. And guilt is perhaps because I didn't go, because I wasn't there, because I didn't call that day, because the doctor never got back to me, because I didn't answer while I was working. All these emotions and symptoms play a very, very critical role in the process of bereavement. And we know that pandemic has made it even more difficult. Next slide, please. So being strong for others and the weight of that responsibility. I cannot begin to tell you how many times I have been with, a family or specific members of the family, and they tell me, I have to be strong so I can't grieve. I can't let my mother see how devastating this is for all of us. I have to be there for her. I have to be there for my wife, my children, my sister, etc. Bearing the brunt of activities and leadership during the journey of grief and loss can be very stressful and very challenging. And this may not end as the time continues and we feel like I'm in charge. So I don't have the luxury of feeling everything that needs to be felt. This can make those grief feel the isolation with more intensity, have a sense of disenfranchisement of their grief, and feel resentful sometimes towards others for not being aware of their own feelings. So we need to share the sorrow. We need to offer practical help, be patient, encourage professionals to help us whenever it's necessary. And what do we say? No te rajes, just don't give up. You can do it. We have to be able to get the help because sometimes we can't, like my little happy and sad faces there. Next slide, please. Understanding our secondary losses, I think I've been very clear about the fact that those are the losses that will continue with us through our experiences, events, thoughts, circumstances, and beliefs of anything that comes as a result of that death of that person who has died and is no longer happening. It could be paying the bills, getting the air conditioner done, making a certain food, preparing for Christmas. It doesn't matter. Secondary losses are constant, and there are just so many of them. We can't really specify them all right now. Next slide, please. And last, I just want to mention that there is a light way before the end of the tunnel when it comes to recovering from loss. Allow yourself to feel that loss, to honor it. Write a letter to that person who has died. Talk to them. Talk to them. It's okay to talk to them. It's you processing these emotions, this change. Set up space or an altar, as is so common for us and so natural, to your loved one, to honor them every day, to pass by and see their picture. Journal writing, as I said, is very, very good. Talk to someone about this, your friend, the one that listens, somebody who's a professional. Remember, grief affects us all. Lend a supporting ear whenever you can. Prepare for recurring grief. And that means that maybe Christmas is going to be harder, or maybe Mother's Day is going to be particularly difficult. So prepare for those days. Celebrate that person's life if you can, and try as much as you possibly could to keep a routine, acknowledging that you need to make spaces and time for this bereavement and this loss. And I think that puts my slides at an end. Thank you so much. Here is one resource that I wanted to, which is Healing the Brain After Loss. It's a great YouTube video. It's about an hour, and I highly recommend that. And then we have the references, I believe.
Can we go to the next slide, please? So here is, if we were not able to answer all of your questions today, please do not hesitate to reach out to our presenter. Elizabeth has been kind enough to share all of her contact information with us today. Thank you so much for that, Elizabeth. Please take 5 minutes of your time today as well to complete the GIPRA, the survey. please, the GRIP evaluation. This is very important for us so that we can gather information about how we can improve our trainings for you. Again, please make sure that you visit our conference website to learn more about all the amazing things that we're preparing for you. This conference is taking place September 15th and 16th in Las Vegas, Nevada. We also invite you to join our final session next Monday, August 1st, at 2 p.m. Eastern time, so we can continue this conversation with Elizabeth. Please share this link with your family, friends, and contacts so that they can join us as well. And we would like to share our contact information with you as well. Please feel free to connect with us in case you have any questions or if you need assistance. Please, here's the PTTC contact information and the ATTC contact information. Thank you. Have a lovely week. See you next Monday. Muchas gracias.